Today we're going to be talking about Bloom syndrome. Bloom syndrome is an autosomal recessive disorder where both parents transfer their Bloom syndrome mutation into their child. This video will teach you about Bloom syndrome and its effects.
What is Bloom syndrome? Bloom syndrome is an inherited disorder characterized by short stature, rashes, and a greater chance for cancer. It is a rare disorder and only a few hundred have been affected and put into books. Some symptoms include shorter than average height, a narrow face, a red skin rash, an increased risk of cancer, and people that have this disease rarely make it past 5 feet by adulthood. They have a high-pitched voice, distinctive facial features, and learning disabilities. Bloom syndrome is diagnosed based on symptoms and physical examination and is confirmed by the results of genetic testing. Cytogenetic tests, which are blood tests, used to test human chromosomes may be done to look for features that are characteristic of Bloom syndrome. Due to serious growth problems, Bloom syndrome may be suspected before birth and can be diagnosed by prenatal testing.
This chart shows potential sequence changes for an individual carrying the mutated BLM gene. In this chart, the first two changes are non-pathogenic. This means that they are not disease-causing. However, the bottom three are pathogenic changes, which means that they are disease-causing. You can see that the non-pathogenic variants result in no change, as opposed to the pathogenic variants that do have a change. The pathogenic amino acid sequences are the ones most harmful to the cell and the ones most likely to cause Bloom syndrome. To put it simply, the variants that are non-pathogenic are also not likely to cause disease, while the variants that are pathogenic are very likely to cause this disease. How is Bloom syndrome caused? The affected gene is the BLM gene. Missense, nonsense, and frameshift mutations have all occurred during testing. Mutations result in the absence of a functional BLM protein. The dysfunction in the BLM gene causes bacteria clusters known as pathogenic manifolds. The BLM gene is located on chromosome 15. BLM protein provides instructions for RECQ helicases. Mutation of this chromosome results in a protein that doesn't function properly.
How is Bloom syndrome inherited? Bloom syndrome is an autosomal recessive disorder, which according to NIH, National Cancer Institute, is when the child inherits one copy of mutated gene from each parent. In meiosis, when the gamete is created, there is a variation from both parents. So the child has inherited the variation from both parents, making it an autosomal recessive disorder.
How can we treat Bloom syndrome? The average life expectancy of a person with Bloom syndrome is 27 years. There's currently less than 200 known survivors worldwide, and Bloom syndrome raises the chance of getting cancer. There is currently no treatment for the genetic abnormality. However, people with Bloom syndrome benefit from sun protection, aggressive infection treatment, and insulin resistance. Treatment is more focused on managing the symptoms of the disease rather than the disease itself.